I'm Jenny Englert, and I'm the President and CEO of First Heath, for those of you who I don't know. And I'm really pleased to be able to welcome you here today. This health center has been a partnership for 25 years between Family First Health, the Health Bureau, York City Bureau of Health, and WellSpan York Hospital. I always think back about how people envision things. We do work now, and we make decisions, and we try new things. And I try to recall people who would have been in my shoes and others who would have been planning for this health center. And they were so insightful to not only understand the needs of this neighborhood and how a school-based health program could support improving health of residents and students, but they were also really thoughtful about the model. Our model is unique in school-based health centers across the country. We are really here as a neighborhood hub with a special focus on students and their families. So we're open year-round. We see people of all ages and stages of life. But we are really excited about the special connection that we have with Hannah Penn students. 30% of the school students receive their primary care health services at the health center, in addition to all the other folks from the neighborhood who are able to receive accessible primary care through the health center services. In total, we take care of 1,200 people annually at the health center here, and we'll welcome you for a tour and follow-up to our press conference today. We're going to hear from some of our partners in this work. It really does take a village to do the work that we do here, and so we're grateful for every partner, current, past, and welcome those that will join us in the future. We do want to say that we added a special partner in 2019 to the work that we do here at the health center. United Healthcare Foundation joined us in our work, infused new dollars and capital into our work, and really enabled us to expand and enhance services. What was unique was that as we did this planning and proposal writing in 2019, we unfortunately didn't know what was about to occur in 2020. But what I'll say is that the support that we've received from all of our existing partners and the new partnership with United Healthcare Foundation really helped us to respond in very unique ways through the early stages of the pandemic, reach out and meet people's needs. Today, some of you may have noticed that there is a what we call Hygiene Distribution going on for our Connections work funded by United Healthcare Foundation, where we distribute to community members toiletries, hygiene products, household goods that they may need to supplement their income and things that they could get through other sources. That's been going on since summer of 2020 and is just one of the projects funded through United Healthcare Foundation work in large part. In addition, we were also able to expand our community footprint by adding community health workers through that funding and extending our work. The intention was that those were going to be really high-touch services and out knocking on doors and in the neighborhood, and that was postponed a bit. But now we're seeing that work really flourish, and it's particularly important to our growing Haitian Creole population in this neighborhood, and to have community health workers that speak the language and understand the culture has been really paramount to our work going forward. I do want to underscore again that the health center takes care of people of all stages and parts of life, well child checks, immunizations, management of chronic illness. This is a primary care hub for this community and students. I want to recognize, before I turn the program over to others, I want to recognize our Hannah Penn team. Now we have great new t-shirts. I didn't get one of, so I'm going to get one of those. But we have Lois and her whole crew. We have community health workers. I want to recognize Nurse Ann from the school district as a really great partner for the work that we do every day. So I want to give a hand to all of those folks. And now I'm going to turn it over to Representative Carol Hill Evans from the 95th District to share a proclamation.
Good afternoon, everyone.
Good afternoon.
Very seldom do I age myself, but I'm very proud of the fact that I attended Hannah Penn when I was in junior high school. Here we are, right? We've come full circle. So anyway, whereas the House House of Representatives of Pennsylvania takes great pleasure in recognizing those medical institutions which contribute to the benefit of their communities and ultimately to all the citizens of this Commonwealth. A federally qualified health center, the Family First Health Hannah Penn Center is lauded as York County's only school-based health center. It provides medical services to all community residents and offers adult and pediatric care, routine health examinations, immunizations, preventive care, referrals, family planning, well baby care, and integrated behavior for health services. Since its inception, the Family First Health Hannah Penn Center has exhibited the highest quality of standards in medical practice and has worked to improve the quality of life for countless citizens. Now, therefore, the House of Representatives of the Commonwealth of Pennsylvania salutes the Family First Health Hannah Penn Center upon its richly deserved recognition, offers best wishes for continued growth and success in the years to come, and directed a copy of this citation, sponsored by the Honorable Carol Hill Evans, be presented and transmitted to the Family First Health Hannah Penn Center, 415 Boundary Avenue in York. Thank you.
Next, I'll invite Blair Brock from United Healthcare.
What an honor it is to be here today, to be part of the celebration of Hannah Penn Center's 50th anniversary. My name is Blair Borat. I have the pleasure of serving as United Healthcare CEO of United Healthcare Community Plan, which serves Medicaid, CHIP, and dual eligible Medicare members throughout the state. But today, I'm here speaking on behalf of United Health Foundation, United Healthcare's philanthropic arm. Foundation works to improve our health system, building a diverse and dynamic workforce, and enhance the well-being of communities. As Jenny said, in 2019, we began a new partnership with Family First and the Hannah Penn Center. United Healthcare's mission is to help people live healthier lives and improve the health system for everyone. And what better way to do that than to support a center where, as a community hub, with a great partner like Family First. We've had the honor of working with Family First for over 10 years. They really get that care goes beyond the doctor's office. Healthcare and social needs are a two-way street. What I mean by that is health issues can prevent people from meeting their personal goals. At the same time, barriers with meeting personal goals can be a barrier to meeting healthcare. So we enter this partnership to expand access to primary care, medical services, behavioral health services. And also, as Jenny said, connections to the community, working with community health partners, working with people in their homes to help members connect to those services they need to help them live a healthier life. So, in short, United Health Foundation could not be prouder of this partnership, and here's to the next 25 years of continued success. Thanks very much.
So school-based health centers don't work without strong partnerships from the school district. I mentioned Nurse Ann earlier, but really the support that we've received over the years comes from the top out within the school district. And we couldn't do our work without that support. So I want to turn it over for a minute to Dr. Berry, Superintendent of the School District of the City of York.
Good afternoon, everybody.
Good afternoon.
My name is Dr. Andrea Berry, Superintendent of the School District of the City of York. I am pleased to be in the company of everyone today and would like to thank everyone involved for their participation and hard work to make this special day happen. Today we are celebrating Family First Health's 25th anniversary with the School District of the City of York and the York community at large. Family First Health had a goal to increase access to health care in a very targeted way. 25 years is a quarter century. That's a long time, right? And so I can proudly say that that they have accomplished that goal and continue to build upon that goal day by day. By targeting specific needs of Hannah Penn neighborhood and communities, Family First Health can offer primary services in a variety of ways. They work towards their goal by collaborating with district and school staff to deepen their impact around health and well-being. We could not do our work without them, and hopefully they couldn't do their work without us. We are very proud of the relationship that we've built, and we are very proud to call it more than just a collaboration or a partnership. We call them part of our family. So Family First Health is very fitting. It is because of Hannah Penn School-Based Health Center that we can offer families in the neighborhood access to health care that they may not otherwise have. The impact that the health center has had on Hannah Penn students and the community is truly remarkable. It is shown that healthy students are more likely to have better attendance, which means more engagement in the classroom and students completing work to the best of their ability. The Hannah Penn-based Health Center currently serves close to 35% of the Hannah Penn K-8 students as primary care patients. This includes primary medical care, medical, dental, vision, and insurance enrollment resources. This allows students and their families to be connected to primary care and preventative services such as well child checks, immunizations, and acute medical needs. Family First Health also has a mobile school dentistry program and can connect students to Family First Health optometry after failed vision screenings. It's no secret that Family First Health has been and continues to be a trusted partner within Hannah Penn and the school district of the city of York. We thank you for your continued support, partnership, and understanding of keeping the well-being of our students as your number one priority. We look forward to continuing to grow and evolve our partnership to optimize how we support the health and well-being of students and their families. I want to personally thank them for celebrating their 25 years and being in our schools, but they were an enormous help with the global pandemic. They were at our service. They helped with PPE. They helped us with just anything that we could possibly ask for. And that was an unplanned event. So imagine what they do with planned events. We thank you for your partnership, and we value it, and we're very, very happy to call you a part of our school district family.
All right, I talked about 3 foundational partners to our work, and one was the school district of the city of York. Another was WellSpan York Hospital, and unfortunately Vicki Diamond was not able to join us, but sent some remarks, a quote that I'll share with you now. Vicki says, she is the Central Region President and President of the WellSpan York Hospital. WellSpan is proud to have been a trusted partner with the Hannah Penn Center from its inception. Over the past 25 years, this innovative school-based health center has become part of the fabric of the local community. It closes a clinical care gap by providing valuable primary and preventative care, oral care, and mental health care for not only the school students, but for families and all the community residents. We're thankful to work closely with organizations like Family First Health that share our mission to build healthy communities. The third leg of the stool when all of this was being envisioned was the York City Bureau of Health, and I'd like to invite Mayor Helfrich to come and make some comments on behalf of the city.
Thank you. I tried to draw Monica in because she knows a lot more about this relationship than I do. What I want to share with you is just I want you to remember being little kids. How many people like to go to the doctor? How many people like to go to the dentist? But imagine having this incorporated, these friendly folks that you see all the time, and Dr. Berry emphasized the word family, and that is what this is about. This isn't the doctor that you have to go to when you're feeling really bad and your mom drags you kicking and screaming. These are people that get to become your family and help you over time, and hopefully then give you an understanding of preventative medicine, of being able to make those regular visits to the doctor that so many of us really do avoid. And not only to our own detriment, but to our community's detriment. Because when we don't take care of ourselves, then the community suffers, not just us and our families. So I really do appreciate this model and celebrate this model. Also, your very strong efforts in making sure that you can communicate with all of the citizens of York City, all the residents of York City. It is truly a model, and indeed deserves to be celebrated today. As happens so often, my proclamation is not that far off from my counterpart at the state who gave one already. So I'm going to jump to the gist, which is the proclamation for Hannah Penn Center's 25th anniversary. Whereas the good health of students and surrounding communities, as supported by the Hannah Penn Center, improves learning, invests in students and the broader population, and is a compelling moral good. Thank you for your moral good. Thank you all for your Therefore be it resolved that I, Michael R. Helfrich, Mayor of the City of York, do hereby congratulate the Hannah Penn Center on 25 years of healthcare services provided to those who need them, recognize the work that Hannah Penn Center's health workers, thank you, and providers do to provide those services, and urge continued support to Hannah Penn Center's mission by healthcare and community leaders. Congratulations and thank you for everything.
All right. Well, I mentioned the team at Hannah Penn. I would be remiss if I didn't recognize, in particular, a long-standing provider. You're going to hear more about her in just a second. But Brooke Lasher is a physician's assistant. She has been with the organization 10 years, which is been a huge benefit, not just at Family First Health, but every patient that she's had the opportunity to interact with. And we're going to close our program this evening, or this afternoon, with some personal experiences that folks have had with our team at Hannah Penn. And like I said, you're going to hear a little bit more about Brooke. I'm going to turn it over to Shane Moore, who's had some experiences that he wants to share with all of us.
Jenny and the leadership and the great staff here at this great organization. And to all of you and the community, good afternoon. And thank you for the warm invitation to kind of help shine some light on the impact that you've made over the last 25 years, but particularly with my family personally. My name is Shane Moore, and I'm honored again to stand before you this afternoon to be able to briefly shine some light on the major impact that this specific health center has had on me and my family. My task is actually very easy this afternoon, as I have the privilege of sharing some memories of a person who was and still is very near and dear to me. And that is in the person of none other than my late grandmother, Gracie, previous patient of Family First, who has since transitioned to her heavenly home back in 2018. She had shared some beautiful sentiments of the Hannah Penn Center, and particularly Family First Health, and I'm honored to be her voice today. My grandmother helped raise me as a child, and with limited resources, and worked 2 to 3 jobs to provide for us growing up. And I've watched her give literally all she had with no expectation of receiving a thing in return. She was a kind person who took care of others but failed to do the same in return for herself. And because of those repeated habits, she ended up suffering from many chronic health conditions that were unmanaged over time. And if I could be transparent, I really can't remember a time where my grandmother was really healthy. I was always close by her side, even as a child, and she would take me along to the doctor's office, and I would try to assist her in managing her care at a young age. And all of you know that that is a barrier within itself. And as I was doing some reflecting on how long we've been connected to Family First Health, I realized that this health center, in its entirety, has been a part of my family's experience for well over 25 years. I remember walking in the doors of the formerly known building, York Health Corporation, in the current Sneaker Villa building back in the early 90s. That kind of makes me feel a little old. If my memory serves me well, I believe my grandmother was under the care of Dr. Aslin Go when she first started, and so she provided quality care for my grandmother for many years. Oops, excuse me. For many years, and the wind didn't cooperate with me. How about that? Let's see. Thank you. Yeah, we're good. So basically, she was under the care of Dr. Go, and she provided the care for my grandmother for many years. And I remember going into the York Health Corporation with my grandmother, and Dr. Go would always greet her with a warm hug and kept her entertained with that infectious laugh. Anyone that knows Dr. Go knows that laugh will keep you coming back to the doctor. She was my grandmother's provider even during the switch. It's a part of Family First Health as well. And so she provided care for my grandmother even up until during the move from York Health Corporation and the Sneaker Villa building to the new building at 116 South George Street, when they changed the name to Family First Health. And I believe it was back in 2014 or 2015 where my grandmother's care was transitioned to Brooke Lasher. And I think she too was at that point transitioning over to the Hannah Penn Center. So Hannah Penn, this Hannah Penn Center became my grandmother's new health home. And as I mentioned previously, my grandmother's care was very complicated. She suffered from congestive heart failure, renal failure. She suffered from chronic COPD, depression, thyroid issues, to name a few. And at that time, she was also taking 13 pills a day to maintain her care. Brooke definitely had her work cut out for her, for sure. Not only did my grandmother have a whole lot of medical conditions to treat, but she also had a whole lot of personality that came with it too. My grandmother was a strong-willed, witty, and feisty woman. She did things Gracie's way and would boldly tell you where to go if you didn't like it. My grandmother grew up in a time where there were some severe racial divides, and blacks did not really trust the healthcare system. And so she had much rather self-medicate herself rather than be treated by a physician who saw her treatment as another meaningful measure to check off a list. She just did not trust doctors in her early part of her care. But it was something about Family First Health, and particularly about Brooke, that she loved so very much and that she trusted. Brooke met my grandmother where she was. She allowed her to be herself, no matter how feisty she was. Brooke took many tongue lashings from my grandmother. She laughed with my grandmother, and she also cried alongside of her. She was patient, yet stern in a way that empowered my grandmother to do things that even I couldn't even get her to do. And if anyone knew my grandmother, you would know that her yays were yays, and her nays were nays. There came a point in her health journey where Brooke could no longer provide the care that she needed. My grandmother's care was declining, her health rather was declining pretty rapidly. And I remember Brooke coming into the room that last visit and explaining to us that her care needed to be transitioned to hospice. and the look of hurt on her face, as though that, wow, I'm no longer going to be your provider. That look sticks with me to this day. My grandmother instantly begins to cry when she got the news. And to my surprise, she wasn't really crying because she was going on hospice, because she made peace with that fact that her time was coming. But she was crying because Brooke was no longer going to be her provider. Brooke was not just my Nana's provider, she was also my Nana's friend. She was one of my Nana's confidants and cut-up buddies. I've had the privilege of working for this great organization, and one thing that I've learned in my role as a care coordinator was that providers cannot do it alone, and it takes a dedicated team to effectively manage someone's care. My Nana adored Brooke to the utmost, but she adored the staff that supported her just as much. She admired at that time Nellie and her warm spirit at the front desk, and the care coordinator who always checked in to see if she needed any extra resources. She adored Lois and her MAs who would greet her in the waiting room. And the beauty of the Hannah Penn Health Center is that it is a small site, which allows for a more up-close and personal connection with staff. And everyone knew my Nana in the Hannah Penn Center, and my Nana knew them. They would even go the extra mile by bringing out a wheelchair to my car for her when they saw us pull up in the parking lot for her appointments. I truly believe this afternoon that this health center helped extend my grandmother's life in ways way past the prognosis given by many specialists. You all were not just treating my Nana's symptoms, but you were treating her heart, mind, and soul. You fought the good fight with her, and you've kept the faith with her, and you've already have finished the race with her, and you've helped her live a very full life. And by doing that, assisting her in this way, you also are assisting me as her caregiver. So thank you for truly caring. Thank you for just being there. Thank you for understanding us. Thank you for your commitment to her care. But most of all, thank you for being our family. Thank you so very much.
Thank you for sharing that. And I think that embodies so much of the work that we strive to do every day in the Hannah Penn Health Center and across our organization. And to have the opportunity to hear about times when it works is just invaluable. Our mission is to improve lives. To know that we had that opportunity with your family is very special. So thank you for sharing that. And now we're going to hear from a current Hannah Penn student, Nicole Martinez-Halwood, is going to say a few words about her experience at the health center. So help me welcome her.
My name is Nicole, and I am a seventh grader at Hannah Penn School. I have been a patient at Hannah Penn School-based health center since I was in kindergarten. By the health center being in my school, my dad doesn't have to leave work to come and get me from school and take me to the doctor. I can see the doctor during my school day by myself. This gives me confidence to talk about what I need to be helped. Like my provider, Brooke, I get to ask her questions and know that she will do whatever she can to help me. Brooke has always been really kind and nice, and I think she is good. Brooke is a great provider because she has always helped me with my health. I also enjoy meeting Charlotte, my health wellness coach. In the health center, Charlotte works with me to and support in making the best decisions when it comes to balance, nutrition, and exercise. The staff is always friendly and helpful to me. Having the school-based health center really gives me the chance to take ownership of my health.
great, right? Nicole mentioned a newer addition to our team, also supported initially in its launch by United Healthcare Foundation, and that is a health and wellness coach. So we have now a staff person with expertise in helping anyone reach their health and wellness goals, and particularly our students. And so I'm grateful that Nicole was able to work with her and highlighted the work that she does. So in closing, I want to recognize all of you for coming out today. All of you touch the work of our health center in some way, and we are incredibly grateful. Our work is changed by the contributions that you make and improved by the contributions that you make. I want to acknowledge a couple of board members that are here today. Without our board of directors as a nonprofit organization, we couldn't do the work that we do. So thank you for being here and for your support, Allison and Mike. Also want to recognize Commissioner Hoke, who joined us along with Mayor Helfrich and Representative Hill Evans. So thank you all for your support. We welcome you on this beautiful afternoon to have some snacks with us and to also take a tour of the health center. If you haven't been here or you haven't been here in a while, we would love to provide you with a tour. So thank you all for being